group, we'll be talking about chlamydias and treponema. Chlamydias are non-motile bacteria. They were once considered viruses because of their small size and attachment to a host cell. But chlamydias have DNA, RNA, and ribosomes. So now they are classified in their own phylum. Chlamydias are gram-negative microbes. They have no cell walls and no erythropods. We will be discussing 3 different types of chlamydias, as you can see on the screen. Chlamydias develop in 2 ways. Both forms of development occur in the endosome of a host cell. The first type of development is elementary bodies. Elementary bodies are usually dormant. They resist elemental extremes and survive outside of the cell. They are also infectious. The second type of development is reticulate bodies. At this stage, chlamydias are non-infective. They replicate via binary fission and survive by inhibiting the fusion of lysosomes with phagosomes. Chlamydias lack the metabolic enzymes needed for ATP production, and they depend on the host cell for energy. In the life cycle of chlamydias, an elementary body attaches to the host cell. It enters the host and triggers its own endocytosis. Then, once it's inside the endosome, the elementary body converts to a reticulate body, which then begins to divide rapidly. When the endosome is filled, the reticulate bodies convert back to elementary bodies. This process, and then the elementary bodies exit the cell. This process continues on infecting more and more cells. This picture is located on page 419. So let's start with Chlamydia trachomatis. Chlamydia trachomatis has a limited host range. Cells with receptors for elementary bodies are located on the conjunctiva of the eye, the lining of the mucous membranes like the trachea and the bronchi. It's also located on the urethra, the uterus, the anus, and the rectum. Clinical manifestation results from destruction of infected cells at the site of the infection and the inflammatory response. Reinfection of any of these sites by the same or a similar strain of chlamydia triggers a hypersensitive response that can result in blindness, sterility, and sexual dysfunction. Chlamydia trachomatis is one of the most commonly reported STDs in the U.S. As well as being transmitted sexually, chlamydia may be transmitted via eye-to-eye contact, and children may become infected as they pass through the birth canal. There are 2 main disease-causing strains of chlamydia. One, as I mentioned, is the STD, and the other is the ocular disease trachoma. I will be covering the STD portion, and Antoinette is going to cover trachoma. STDs are caused by the LGV strain of C. trachomatis. There may be 2 or 3 stages that occur when affected. Stage 1 is a lesion occurs at the infection site. Usually this is on the penis, the vagina, the urethra, cervix, or rectum. The lesion often goes unnoticed because it's small, painless, and heals quickly. At this stage, headache, muscle pain, or fever sometimes occur. At stage 2, there are development of bobos, which are swollen lymph nodes. Fever, muscle pain, and draining also occur. Not many cases develop past stage 2, but those that make it to stage 3 suffer from genital sores, constriction of the urethra, and genital elephantis. Men may suffer from lymphogranulonum venereum, which is painfully swollen lymph node in the inguinal area. Women may develop pelvic inflammatory disease, which results in damage to the uterus, ovaries, and can cause sterility. Now Antoinette is going to talk about trachoma.
and is the leading cause of non-traumatic blindness. It causes post-field discharge that scars the conjunctiva and causes the patient's eyelid to turn inward. It is typically a disease of children who have been infected during birth. It may produce blindness in adults when bacteria from the genitalia are introduced to the eyes via the fingers. Diagnosis of chlamydial infections involves demonstration of bacteria inside cells from the site of injection. Specimens can be obtained by swabbing the urethra, vagina, or the uterus, or the anus. Physicians prescribe tetracycline and azithromycin for 21 days to eliminate the infections. Prevention of STD is best achieved by abstinence, and blindness can be prevented only by the prompt treatment with antibacterial agents. Another type of chlamydia is chlamydophila pneumonia. It causes about 10% of the U.S. cases of pneumonia. The infection is usually mild and causes only malaise and a chronic cough. It causes 5% of cases of bronchitis and sinusitis. It spreads via the respiratory droplets and is hard to treat. It's usually treated with antibiotics such as tetracycline and erythromycin. Another form of chlamydia is Chlamydophila psittaceae, transferred to humans by birds. It causes flu-like symptoms, and in some cases the pneumonia even occurs. People at high risk are zookeepers, veterinarians, and bird owners. I'm sorry. In some cases, it is called parrot fever because it was first identified by parrots. The disease is sometimes underreported because the symptoms are often mild and diagnosis is difficult. Elementary varieties of chlamydophila may be inhaled or ingested. Symptoms usually occur within 10 days of exposure, and doxycycline for 2 weeks is the preferred treatment. Prevention involves wearing protective clothing when handling birds and regular cleaning cages to prevent transfer of feces, feathers, food, anything associated with the birds, and no vaccine is available to birds or humans. Our next topic of discussion will be treponema, and Kara will be coming to you talking about that.
The next section that we'll be discussing is treponema. It causes 4 types of diseases: Treponema pallidum, Treponema pallidum indicum, Treponema pallidum pertinu, and Treponema cariateum. The pathogen is for humans only. Treponema pallidum is sexually transmitted. It is the cause of syphilis. It has flattened helical cells, which can make it difficult to view under normal microscopes. It requires a dark contrast or light field microscope to view it. It is destroyed by soap, exposure to heat, disinfectants, among other things like pH change. It cannot be cultured in a cell-free media. It requires to be grown in the human body or in a cell media. It cannot live in the environment, and outside of humans, it reproduces slowly and usually only for a few generations before dying off. Syphilis, which is caused by the Treponema pallidum, occurs worldwide, and the first recognized cases were around 1495, which makes some scientists suspect that it was brought back to Europe by Spanish explorers when they went west to look for new land. The antibiotics reduce the number of syphilis cases greatly now, and it is still prevalent among sex workers, men who have sex with men, and users of illegal drugs, especially those that require needles. It is transmitted almost solely through sexual contact, and it consists of 4 stages. The inability to culture it does make it hard to determine virulence, and the risk of contracting syphilis from an infected person is 10 to 30% from one single unprotected sexual act. The primary stage of syphilis, it involves the forming of a reddened lesion at the site of infection. Most form on external genitalia, but for women it usually forms on the cervix, which means that the lesions usually go unobserved more often and for longer by women as opposed to men who would be able to see the lesion. The reddened lesion does fill with serum that is infectious. It can remain for weeks and then disappear without scarring. In about a third of the cases, this stage is the end of the disease for people. The secondary stage of syphilis, most cases do go on to this stage because of the untreated lesions that either are unobserved or ignored. The rash lesions are extremely infectious. Some of the other symptoms are sore throat and a headache. The rash can last for months. This entire stage could last for months, and the disease can be spread from fluid that is contained within those rash lesions. The latent stage can last 30 or more years, but most cases don't progress to that point because people seek treatment once they start observing the rash and other symptoms. The tertiary stage of syphilis, about a third of the infected cases go on to this point, mostly from severe complications resulting from inflammation and hyperimmune response to the virus. It can cause dementia, blindness, paralysis. It can even cause heart failure. The syphilitic lesions are rubbery, they're painfully swollen, and they can occur in bones, nervous tissue, or skin. Congenital syphilis occurs when syphilis is transferred across the placenta from an infected mother to her fetus. And the treatment for syphilis in really any of these stages would be penicillin, or for those who are allergic to penicillin, doxycycline. There are a few non-venereal treponema diseases, but they're mostly seen in Africa, Asia, Central and South America, and they are transmitted by contact with lesions that contain serum or some type of fluid, and they result in scarring and disfiguring.